I'm Dr. Blanche Grube, and I would like to comment on an article written on the internet, released on the internet, entitled "Poor Oral Health Could Raise Oral HPV Risk." HPV stands for human papilloma virus, which has been known to be a precursor to the development of cancer. I thought it was an interesting article because number one, they had a lot of subjects, 3,439 people. I think that's a fair number, between the ages of 30 and 69. And what they found was that the people who had poor oral hygiene had a much higher risk of developing HPV virus. And this was separate from people who had other bad habits that also contribute to poor oral hygiene. For instance, multiple sexual partners, a lot of oral sex, marijuana use, cigarette use, and actually being a male was identified also as high risk for HPV. But the researcher found that poor oral health, poor oral hygiene was an independent risk factor for infection. Well, this kind of fits into the things that I've been saying all along, that you cannot have one part of your body be unhealthy and have it not affect every other part of the body. We are a whole organisms. That's why I like the term holistic dentistry. You can't have a schmutzy mouth and expect your heart to be healthy. You can't have a schmutzy mouth and expect your hormone levels to be healthy. You certainly can't have a schmutzy mouth and expect to have safe sex with another partner. It just doesn't go that way. So I have always said a healthy mouth is something that is much more important than most people think it is when growing up. So now we have one more thing to consider. Do we want to become vulnerable to the human papilloma virus? And if we don't, then making sure that your mouth is healthy, clean, free of heavy metals, free of toxic substances is very, very important. Thank you for watching. This is Dr. Blanche Grube.